Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of this show, I'm going to continue to talk about hypertension. Hypertension is a very common disease. Worldwide, 1.5 billion people suffer from hypertension. In this country, 76 million folks have hypertension and 67 million folks have the so-called pre-hypertension. About 7.5 million people every year in the world die as a result of hypertension and its complications. In this country, it is said that 46,000 deaths could be prevented every year if hypertension is diagnosed and treated properly. When I left off last week, I was talking about the effect of hypertension in the kidney. The kidney is the organ that is responsible for the development of hypertension, as well as the kidney is a key organ that is necessary to be functioning well so that we could properly treat blood pressure. Now, the complications of hypertension is devastating. Of course, it causes stroke, heart attack, kidney failure, etc., etc., congestive heart failure, etc., eye problem, etc., glaucoma, etc. Now, the problem is, let's take the example of the black community in this country. 1 out of every 2 black adults suffers from hypertension, and 1 of every 3 Caucasian adults suffer from hypertension. So this is how common the disease is. Unfortunately, it's devastating because it is associated with obesity, poor diet, too much salt on the diet, etc. The report just came out recently, 40.2%, not percent, 40.2 million women are obese in this country, and 35 million males are hypertensive, and it's 40.2% women are obese, and 35% men are hypertensive, and 17% children and adolescents are hypertensive, are obese. Now, this creates a lot of problems. When I left off, I was talking about how does the kidney get to become sick because of hypertension. I mentioned the fact that the elevated pressure within the different arteries and arterioles, etc., inside the kidney causes the development of plaque. And I explained the mechanism because they verify that the pressure is high, that causes an aberration to develop inside the wall of the vessel and the intima, and then that leads to things to happen, and then one thing pile up on top of another, then you have plaque from development, and that then results in narrowing of the vessel, thereby impeding blood flow to the kidney. The network of substance inside the kidney that needs to be fed with blood and oxygen, of course, is the glomeruli. And the glomeruli, when they're dying, they cause no pain whatsoever. You don't know they're dying until one day something happened and the kidney just simply failed. Now, when that happens, a whole host of other things happen. Let me give you an example of how bad the situation really is in people who have dark skin. All dark-skinned individuals, 90% of them have low vitamin D. How do you go from low vitamin D to problem with blood pressure? Well, low vitamin D causes the so-called renin-angiotensin-aldosterone system to become overactivated. And the overactivation of that system makes it much more difficult to treat blood pressure because the pressure stays higher. Not only they're not going for treatment, even if they do go for treatment, they also wind up with low vitamin D. And unless you diagnose the low vitamin D and give them the appropriate amount of vitamin D to correct that problem, you're going to have great difficulty in controlling the blood pressure. That's a major problem. And of course, on top of that, folks eat a diet that is too rich in salt. The average salt consumption in black folks in this country is 7 grams. 7 grams. And the The latest recommendation by the FDA is 2.3 grams of salt per day. It's very important because salt is key, because wherever salt goes, water follows, and that combination causes an expansion of the so-called intravascular system that then causes the blood pressure to go up. So salt retention is the key. And it is easy for me to sit here and talk about it, but it is not easy for the people who are going through it because they don't have enough money to buy the proper food to eat. They eat the food that they can afford, which is mostly fast food and so-called junk food. And that's what they can afford, and that's what they eat because the economic situation is so poor, they're not able to eat the high-quality food that is less loaded with salt. As it turns out, there are many, many, many foods that we actually, canned food, bread, etc. The list is on the internet. The FDA listed it, all the different food that before we even put it in the pot to prepare it, it's already have too much salt. And then on top of that, some folks add salt to it. So that's part of the problem. Now, once the kidney becomes damaged, then somebody shows up in the office and we need to know, we find that they have high blood pressure, then we have to evaluate them completely. But one of the organs we're going to, of course, evaluate is the kidney function. I mean, you have to do an EKG, you have to do a chest x-ray. You could see an enlargement of the heart on the chest x-ray. You could see an enlargement of the heart on the EKG as well, and other abnormalities, etc. So what are you looking for in the kidney function test? Well, you do a blood count. How do you go from a complete blood count to associate that with kidney malfunction? Well, if the red blood cell count is low, there are hundreds of things that can cause one's red blood cell to be low, but I'm talking about kidney failure or kidney insufficiency for that matter, because that's where the problem starts. There's a substance, since it's really basically a hormone that the kidney produces in adult called, that particular erythropoietin is the name of it. Erythropoietin is produced by the kidney, and then it gets picked up by the bloodstream, taken to the bone marrow to stimulate, to be incorporated into early red blood cell to produce red blood cell, erythropoietin. But the kidney cannot produce sufficient erythropoietin if it is sick. So therefore, when you do a blood count, you're likely to find anemia based on the extent of the damage of the kidney. So that's where you do the blood count. You do the so-called renal function test, which is basically, that includes the blood sugar, the creatinine, the BUN, the sodium, the chloride, the potassium, and the bicarbonate. That's the kidney function test. Well, when the kidney begins to fail, one of the first things that's going to happen is that the blood urea nitrogen started going up, and the serum creatinine start going up as well. So that's an indication something is not quite right with the kidney. And later on, as things get worse, the electrolytes start being affected, and the electrolytes, of course, are sodium, potassium, chloride, bicarb. Okay, so that's what you look at. Now, when you're looking at these things, you also want to take a look at the urine. What are you looking for in the urine? You're specifically looking to rule out an infection, because if the kidney is sick, an infection can also cause the kidney to be sick. So you want to make sure that this is not an infectious problem that's affecting the kidney. So you do the urine analysis, looking for pus cells, looking for bacteria. You may even send a urine culture, etc. In addition to that, take a look at the protein. The sicker the kidney, the more it's going to filter out protein. And that's a very dangerous combination. And the sicker the kidney, the more protein one passes in the urine. That can in fact lead to a condition called nephrotic syndrome. Nephrotic syndrome is that the kidney is so sick, the filtering mechanism of the kidney just becomes so porous that it's pouring proteins out. So you say, what's the big deal? Well, not only that, it's a big deal. It can cause a lot of problems, including clotting. How do you go from protein being passed in the urine to clotting? Well, when you're passing protein in the urine, there's this protein that we carry in the blood called protein C and protein S. Well, In addition to passing out albumin, you're also going to pass out protein C and protein S. Well, when you do that, you drop the level of these things, the protein C and the protein S, the individual becomes hypercoagulable, and he or she can clot. How about that? Okay, can clot. And sometimes the clotting involves vessel inside the abdomen itself and the vessel that carries blood to the kidney as well. All right? And the clotting, of course, can occur anywhere. So that's very important. In addition to that, you need to know you could do a creatinine clearance, what we call a creatinine clearance, that tells you how much function the kidney has left. Even more accurate test is the glomerular filtration rate. That tells you how much. You have to remember kidney abnormality is graded from 1 through 5. But also the glomerular filtration rate is a very sensitive test, and the commercial laboratories actually give it to you as part of the blood chemistry profile that you order. That allows you to have a chance to properly evaluate the function of the kidney. That's very important, okay? Super, super important. So you have to understand, you have to know when and how to do these tests, And of course, it depends what it is that you're looking for. If it is blood pressure that's causing the kidney to become damaged, then of course, the higher the blood pressure, the more likely it's going to damage the kidney, and ultimately the kidney wind up failing. You wind up having what's called end-stage renal disease, okay? And then, of course, the next step is dialysis, either peritoneal dialysis, hemodialysis, and the patient will go on a list hoping to have a kidney transplant, etc. And then the importance of that is that then once somebody has hypertension and the kidney has failed, then it is so much more difficult to control the blood pressure because the kidney is not there to help you. You can't force the kidney to excrete the salt the way you would have ordinarily. You can't do that. So you have to come up with other medications, such as a calcium channel blocker in particular. You try to stay away as much as possible from an ARB, which is angiotensin receptor blocker, because the ARBs has a side effect of causing the potassium. They can cause the potassium to go up. And when someone has kidney that is failing or has already failed, one of the danger is high potassium. So you try to stay away from an ARB. So you would treat the patient with what's called calcium channel blocker. You could give the patient at that point a beta blocker. Yes, you can at that point because at that point the renin is up. Everyone who has kidney failure, end-stage kidney failure, have high renin. At that point, you might be able to use a beta blocker in such a setting, and you could also use an alpha blocker, such as clonidine, stuff like that, to try to control the blood pressure. And depending on what else is happening with the patient in terms of end-stage renal disease, you could also have organ failure like the heart. That gives you an excuse to use a nitroglycerin-type substance medication. That is, because we don't use the nitroglycerin necessarily to treat somebody who's having chest pain because of angina. We're taking advantage of the fact that the side effect of hydroglycerin is to lowering the blood pressure. We use it in this setting to help lower the blood pressure as well. You could use a nitro-paste pass, or you could just use isosorbide or sublingual nitro or whatever. So that helps you to lower the pressure. So the whole management of someone who is hypertensive or also his kidney has failed, in addition to dialyzing the patient, management of diet, etc., you have to know what type of blood pressure medication you can or cannot use in the individual, because water pills, such as hydrochlorothiazide, not only won't help you, it will be inappropriate because the patient likely not passing enough urine. Even if he or she was passing urine, the urine would be ineffective urine. There wouldn't be enough salt in it, etc. So you really have got to understand the clinical medicine system that allows you to still treat the blood pressure and yet the kidney has failed. So that's something that you either know it or you don't know it, but that's what clinical medicine is all about. So that's as far as I'm going to go as far as the kidney is concerned. The next organ, the reason why they dealt with the kidney first, because the kidney is where hypertension starts, And I thought that was a good thing to describe that first. So now we'll start from the top. Let's go and talk about the brain. How do you go from the brain being affected in someone who has high blood pressure that can lead to stroke, etc.? 700,000 folks every year in this country develop stroke. That's a very common disease that can lead to death as well as or to paralysis. Every second in this country, every minute, folks are developing stroke, etc. Well, that's one of the major complications of hypertension. That is why it is so important that one first diagnose it and then know how to manage it. You have to understand, it is only somewhere between 28 and 30, thereabout percent of folks who are actually going to the doctors are having their blood pressures controlled. I'm not mentioning about those who don't go at all. I'm talking about those who are actually going, who have the blood pressure well controlled for a variety of reasons. Lack of compliance, don't have enough money to buy the medication, the improper medication. That's right. A lot of that is because the medications that are being prescribed are not appropriate for different ethnic, racial subgroup. One has to understand that. I know it's an uncomfortable conversation for people to talk about race, and yet this great country of ours, the greatest country on the surface of the earth, that has done so much for so many people, including me and my family, has this one Achilles heel, that's racial discrimination. And it affects and penetrates all aspects of our lives. Look at the unfortunate event that took place in Orlando this past week. These folks just having a good time to relax, and somebody decided to murder them. 49 folks get murdered, innocent people having nothing to do with anything. They were just having hard-working men and women who just having a little pleasure time to relax and let off some steam. And for that, they get killed because of somebody's crazy notion that because of their sexual orientation, that individual would have developed such a terrible hatred towards such people to try to murder them. For what reason, nobody knows. And this is, I said that in previous show, I'll say it again, the number one disease in this world that we live in right now in the 21st century happen to be racism of different types. It's not just skin color or racial, it's just racism. People don't like people's sexual orientation, they develop a hatred toward them. People don't like people where they come from, they develop a hatred against them, and so on and that. People don't like people of religion, they develop a hatred against them. And this is ridiculous. And it's an outrageous. As a citizen of this country and a citizen of the world, it is my responsibility to also express my distaste and disgust about what happened in Orlando this past weekend. It is unacceptable behavior, totally unacceptable, cannot be justified, and it ought to stop. That being said, getting back now to my role as a physician and teacher, let's talk about the brain. The same thing applies. When the pressure arises inside the vessel, inside the brain, the first part of the vessel called the intima becomes affected because of the fact that the pressure is high. Because of that, the smoothness inside the blood vessel no longer exists, and debris and other things that's passing through begin to get trapped, and then one pile up on top of another, one thing pile up on top of another, and you started having plaque development, which then leads to narrowing of the vessel. And once the vessel becomes narrowed, then blood cannot pass through properly, and the more narrow the vessel, the more likely that it might prevent blood from going through a particular part of the brain, leading to an ischemic stroke. In addition to that, when the vessel is so diseased because of plaque, the tensile strength of the vessel is no longer strong, and it can rupture leads to a bleeding, hemorrhage, stroke. Okay? Another form of stroke, of course, is you could throw a thrombus to the brain, coming from usually from the heart, and so on and so forth. And there's another organ that I haven't mentioned. Yes, this is the carotid vessel right here. They're part of the high flow system. They also can develop plaques, and the plaques can cause narrowing of this vessel, either one of them or both of them, preventing blood from going through effectively, and one can develop a stroke because of them as well. And then, of course, unless someone has an aneurysm in the brain or some other congenital issues in the brain, usually strokes develop because somebody is hypertensive, they have diabetes, they have high cholesterol, or a combination thereof. All these three things can lead to the formation of plaques in the vessel. In addition to that, all chronic inflammatory diseases of different types, of which there are thousands, can also lead for plaque formation in the high flow system, because inflammatory material, as they're passing through, they get stuck in the vessel, and then there you have the process of plaque formation that can lead to narrowing of such vessel. So stroke is very common, and the way you go to evaluate it, of course, you would do a CAT scan of the brain. The CAT scan of the brain, if somebody shows up with a symptom of stroke, which is weakness, inability to talk, facial droop, and so on and so forth, and then they're stumbling all over the place, they can't walk or whatever, you think they have a stroke, you will naturally carry out a complete, thorough examination. If they can give you a history, you take it. If they can't, the family or wife or spouse or girlfriend, boyfriend can give you a history, and you take that. The family history is very important. After you've taken the history, you're going to do, first thing we're going to do is to do a CAT scan. The CAT scan will show you if there was old disease from the past, or if there is acute bleeding into the brain. It will not tell you if you have an acute ischemic stroke. The CAT scan will not tell you that. What will tell you that, however, is an MRI. An MRI of the brain will tell you if you have an acute ischemic stroke. Obviously, it could tell you for a bleeding stroke as well, or whatever else may be taking place inside the brain. It's important to do that right away so that you kind of know what you're dealing with. And there are many, many medical conditions that can lead to stroke besides hypertension. I'm not talking about those. I'm specifically talking about hypertension. Then naturally you will do a chest x-ray. You will do an EKG. What are you looking for in the EKG? You want to make sure the rhythm is normal, that the patient doesn't have atrial fibrillation, because atrial fibrillation can lead to a thrombotic type stroke, can cause a thrombotic type stroke, so that's what you're looking for. And the reason why that happens is because when one is fibrillating, the cavity inside the atriums, the blood get deposited there. The blood, as it sits there, because the atrium cannot pump it properly, it begins to develop little clot inside it. That's right. If the atrium is fibrillating all the time, that's less of a problem. Unfortunately, intermittently, the atrium contracts as well. As the atrium is contracting, it's dislodging that little clot that was sitting there and dislodge it into the brain and cause a stroke. That's correct. If you're fibrillating all the time, there's a whole lot of problem that can be happening to you, but you're less likely to have a stroke. Unfortunately, this is not the way it works. Intermittently, everybody who are fibrillating, also intermittently, every few moments, the atrium contract normally. That contraction then will dislodge the little clot that was sitting there, because the blood, when the atrium is fibrillating, it can't pump the blood out. The blood becomes stagnant. The stagnation of the blood can cause little clot to develop. That's what causes the stroke. And all this medication that we use, including aspirin, is to prevent that little clot from forming in the first place. Okay? So that's how that happens. Okay? So the brain, in addition to that, the MRI will show you how much damage has occurred in the high flow system of the brain over the years. You have what called microvascular disease of the brain. Chronic microvascular disease, you could actually see that on the MRI. That means that you have a lot of little stroke that has occurred over many years, and these are not reversible. They're not reversible. That's right. So the damage is permanent when those little things happen. So microvascular disease of the brain is very bad because that can lead to transient ischemic attack. It can also lead to dementia. In fact, most black folks who have dementia don't have Alzheimer's. What they have, in fact, is microvascular disease of the brain that leads to dementia. That's what they have more commonly than the Alzheimer, which is about 5-6 million folks have Alzheimer. You have multiple times more folks with dementia because of the incidence of blood pressure is so high and mismanagement is so high. These folks wind up with dementia not because they have the Alzheimer. So most black folks who have dementia, in fact, don't have classic Alzheimer's. They have dementia secondary to microvascular disease of the brain, secondary to hypertension, diabetes, or cholesterol, or a combination there. You understand that? So the brain then get damaged, and these folks become demented. Some of them have intermittent seizures. They have, you have 45-year-old men and women walking around that are demented because their blood pressure, they were hypertensive since they were in late teen, was never treated or treated properly, and they wind up being demented early because of microvascular disease of the brain. And this applies to everybody across the way. They don't necessarily have to be black. As long as the blood pressure is not well controlled, microvascular of the brain can occur. Listen, next week, I'll continue to talk about high blood pressure and its effect on the brain. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.